And with the first bill, I would like to welcome Representative Beeman. It's House File 564. I would like to move that House File 564 be re-referred to the Education Finance Committee. Please welcome to the committee. Introduce your bill.
Thank you, Mr. Chair. Thank you, committee members, for the opportunity today. I'm not sure, Mr. Chair, if we need to move my amendment to the bill.
Yes, you have an A1 amendment. I would like to move A1 amendment for the bill. Any
Thank you.
discussion on the A1 amendment? This
Basically, Mr. Chair, basically it's just changing the title of the contracting agency.
good. Discussions, members? See none. All those in favor of approval of A1 amendment, please say aye.
Aye.
Opposed? The amendment A1 is now adopted. With that, to your bill as amended, Representative Beeman.
Thank you, Mr. Chair and members again. Just a bit of background, the school-linked behavioral health services grant funds were part of the governor's mental health initiative passed by the 2007 Minnesota legislature. The goal was to eliminate the barriers to accessing treatment and completing treatment plans, which included the inability of parents to take off work every week for 20-plus weeks, transportation issues, especially in greater Minnesota, poor insurance or no insurance, and difficulty navigating the mental health system. The grants are provided to community mental health providers who co-locate in the schools. They diagnose and treat children and work with parents and teachers to support the child. They can bill public and private insurance. Treatment is not limited to special ed students. There's also a firewall between the healthcare and education records. The professionals can see the child in their own milieu and work closely with the school support personnel. Funds are used for children who are uninsured and underinsured and for services for which you cannot bill insurance. It is a highly successful and well-loved program. To truly help all our children, we need to make sure this program is available in every school building. Funding is included in the governor's budget and is strongly supported by the Mental Health Legislative Network and educators. Mental health issues are diverse. This bill will help kids with issues of stress to substance use disorder and everything in between. And members, I just want to add a personal story. I've only been in the legislature a few years. One of the meetings that had the most impact on me was to meet with the school counselors within a senior high in my district. And I met with them, discussed their work, and they described their role in the Office of Counseling as a clinic. But in the middle of this clinic is an emergency room. And that's what they deal with every single day. Kids who come in the office, they need help now. And I counted the counselors and I divided the school numbers by the counselors, and it was about a 1 to 700 ratio. So we have a lot of work to do to get to where we can deal with the issues our kids are facing. Right after that visit, I went to an elementary school and I spoke with a teacher for about 30 minutes about issues in her classroom. And we talked a lot about public education and what she's what she's dealing with. But at the end, I asked her, what is your most significant challenge? What's the number one concern you have? And without hesitation, she said, the mental well-being of my students. This is a 20-year veteran of school education. And the big thing here now, members, is that these conversations occurred before COVID. So the need is greater than ever before for this legislation, and I hope you will support it. Thank you.
Thank you so much, Representative Beerman. To the first testifier, I have Sue Abderholden. Welcome to the committee. Please introduce yourself and proceed.
Thank you, Mr. Chair and members. Sue Abderholden, Executive Director of NAMI Minnesota, National Alliance on Mental Illness, and also representing the Mental Health Legislative Network, a coalition of over 40 organizations dedicated to building our mental health system. I was involved in the very first legislation back in 2007, and I need you to know that this program is frankly the best thing since sliced bread. You can talk to any parent, any teacher, principal, and they will all say that the presence of mental health professionals in the school has had a positive impact on both the students' mental health and their academic success. The symptoms of a mental illness impact a student's ability to concentrate, remember, and more, and it impacts them both socially and academically. This program has helped students in all parts of the state, rural, suburban, and urban. And I think what's really important, having come to you nearly every year to get more funding for this program, is it has always enjoyed bipartisan support. It didn't matter whether it was Democrats or Republicans, everyone has really supported this program because they've seen the impact in their own communities. And I will have to say that now more than ever, we need to be increasing access to mental health treatment and services for our children and youth. The CDC reported that 37% of high school students reported poor mental health. 44% reported being sad or hopeless. 26% reported suicidal thoughts, and 12% attempted. Children have been through a traumatic time for all sorts of reasons. And so we need to help these children understand and cope with what they have gone through. And if they're struggling with their mental health, they will struggle to do well. They won't do well in school and in life. So it's really important we address their needs. And I just want to say that if you think about what we call kind of the PBIS triangle, that there's a lot of things we can support the kids on the bottom, right? Small things. The kids in the middle are the ones who the school support personnel, the counselors and the social workers really help. And the kids at the top who need actual treatment are the kids that are being served by this program. So I urge your support. Thank you.
Thank you so much, Sue Abderholden. And the next person on the list is Lisa Shaw. Welcome to the committee. Please introduce yourself for the record and proceed.
Mr. Chair, members of the committee, my name is Lisa Shong. I'm a licensed marriage and family therapist and the clinical director of Change Inc., school-linked mental health program. Thank you for giving me this opportunity to speak about school-linked mental health today. School-linked mental health has increased accessibility to some of the most disadvantaged communities who are least likely to access mental health services. Barriers that families experience are language, cultural, economic, transportation barriers. Students and families who are uninsured, underinsured, or not insurable, and caregivers who have their own mental health challenges. School-linked mental health is responsive to these barriers. School-linked mental health expands beyond just the school setting. We also reach and extend our arms out to the community and homes of students. We go where children and family are. My colleagues and myself have sat in many living rooms, homeless shelters, libraries, and parks, engaging a whole family in a student's care. Most importantly, providing culturally responsive school-linked mental health services means the clinician understands the culture and the language of the student and family is at the forefront of their work. In a perfect world, we would have an abundance of clinicians who look like our students and speaks their language. This area of school-linked mental health is in need of innovation and partnership with cultural communities that represent the students. In addition to increased access, school-linked mental health clinicians collaborate with the school to encourage students and school staff to view mental health in a healthier way to reduce stigma. Students learn that you are not the only one. Your caregiver is not the only one. It's a validating and normalizing experience. It makes it okay to talk about mental health. This is a story of how school-linked mental health and school partnership has made a difference in the lives of students and their families. At one of our schools, students witnessed their bus driver getting shot on their way home. There were 3 children on the bus, all under the age of 10. The oldest, with a very heroic heart, told the students to get on the floor, to not look, and proceeded to shield them with his body. Early the next morning, the school principal reached out to our schooling therapist for help in offering mental health support to the children and their families. Within the hour, our agency were able to rally a group of Spanish-speaking therapists to meet the parents and the 3 children in a reflective group healing process. Our schooling staff used play therapy tools to help the children feel safe and at ease, and invite them to share anything they wanted to about the incident. And the children shared their memories, fears, curiosities, and needs. Both children and caregivers left feeling seen, supported, heard. A wise mentor of mine said, "Children belong to families, and families belong to community." I believe that day proved true to that statement. Thank you again for this opportunity, Mr. Chair and members of the committee.
Thank you, Ms. Chung, for your testimony. Appreciate the work that you do. The next person is Kim Lewis. Welcome to the committee. Please introduce yourself and proceed with your testimony.
Good afternoon, Mr. Chair and committee members. My name is Kimberly Lewis, and I represent Minnesota's 333 school boards across the state. I'm really pleased to offer full support to Representative Bierman's bill to expand children's school-linked mental health services. From around the state, we hear from school board members that students are struggling with their mental health. This is not just an urban or suburban issue. Greater Minnesota, too, has students who are struggling. To address their needs, we need to look at building comprehensive school mental health systems, which includes partnering with community mental health agencies. Students who have good mental health are more likely to engage in school, develop healthy relationships, and be connected to adults. It's what we all want for our students. Not surprisingly, like many other areas in healthcare, there is a workforce shortage for mental health professionals. This shortage is impacting school districts as well. Working for a school-linked mental health agency has different challenges than working in a private pay environment. Because of limited funding and competitive grants, some providers, even though they are doing great work, could lose the grant, and then those relationships are damaged, or they could lose the amount of funding and then not be seen as many children. Minnesota's school-linked mental health program is a national model. Early diagnosis and evidence-based treatment has led to a decrease in suspensions, reduced office referrals, and better mental health outcomes for Minnesota students. We should build on this success and work towards having school-linked mental health services in every school building. To get there, we need programs like school-linked mental health grants. Having mental health professionals in the school who can collaborate with the teachers, school staff, and school support personnel simply leads to better outcomes. These grants make it possible for children to get diagnosed and treated. Schools that have these programs report the positive impact it has on students, families, and the school community. But the program is not in every school building, and many programs have waiting lists by late fall. The needs among our students are great. This bill helps fulfill those needs. MSBA has a legislative policy or position that the legislature should provide dedicated, ongoing financial resources for mental health in schools. In recent years, the school-linked mental health grants have served our students well, and this system is tried and true. Consistent funding for school-linked mental health is necessary not only to ensure services are available to all who need them, but to ensure staff pay is competitive. Ask any principal or superintendent what they worry about most right now, what keeps them up at night, and they'll say the mental health of our students. I urge you to increase the programs or the fundings for these programs. Thank you so very much.
Thank you so much for your testimony, Ms. Lewis. Appreciate the work that the Minnesota School Board Association is doing to support our students. With that, I have public testifiers. Ray Parker, welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Hello, my name is Ray Parker. I'm from Rochester, Minnesota, and I'm testifying against HF Bill 564 due to its lack of specific language, which is appalling to me. Although admirable in its attempts to placate the public by adding this bill into law, there's nothing stating how much money will or could be appropriated to fund these mental health and behavioral issues. Who's deciding what constitutes these issues to be addressed? And who are they competing against to get this appropriated money? School districts, schools within a district, counties, cities. This appears to be another bill designed to look like it will benefit a group of people in desperate need of such funds, when in reality, those in need will likely never see any help by receiving what is dangled in front of them. You don't even specify who the school-linked mental health issues and behaviors are. Are they for students only, for teachers, for parents, for grandparents? And what are the determined treatments? Drugs, isolation, incarceration, surgery, euthanasia? Without specific language in place, this is too ambiguous and open for any interpretation the majority wants it to say. For instance, yesterday, pedophilia was a crime, and now you can't even say pedophilia. It's MAPS, because labeling them with that crime name might stigmatize them. Yesterday, complying to no prayer said out loud. Today, you can be jailed for just looking like you are in silent prayer. So again, who's defining the mental health issues and behavioral issues, and what treatment you'll be
excuse me,
given?
Fisher.
I think I'm sorry to interrupt, but it feels like we're straying from the bill, Chair Nor.
That's correct, Chair Fisher. I was going to notify the testifier, please stay within the parameters of the bill that is discussing school-linked mental health. Please.
Okay, well, you know, a lot of it is targeting to propagandas that are being put forth in the schools. The extended distance learning was also identified in several areas as being part of this mental health issues. And without saying what you're doing specifically to give help to these children, without saying, is it only students? Is it the families, meaning teachers, parents, grandparents? It's too ambiguous. I say vote no. It's not ready for prime time. Thank you.
Thank you for coming to testify. The last on the list, if there's any other public testifier, please let me know. Anyone else? I would like to invite Christy Graham from the Department of Human Services to testify on this bill. Please introduce yourself for the record and proceed.
Thank you, Mr. Chair. For the record, my name is Christy Grom, and I'm with the Department of Human Services. So first, I want to extend a note of gratitude to Representative Bierman for being such a champion on this issue over the years, as well as to our partners and colleagues at the Mental Health Legislative Network and NAMI Minnesota, who have also really been important advocates in this endeavor. One of the foundational elements of the governor's and lieutenant governor's budget for 2023 was really to make sure that Minnesota is the best place for children to grow up in, whether they're black, brown, whether they live in greater Minnesota, urban parts of the state, suburban parts of the state. We really want to make sure that all children have opportunities to succeed. And so as part of that priority, one of our key investments is in the School-Linked Behavioral Health Grant Program. So you'll see that reflected in our DHS budget recommendations. We've got $8.25 million investment in 24-25 and a $16.5 million investment in 26-27. We also have an investment in a similar grant program for the intermediate school districts, so those districts that serve students who have more challenges, and so we've got $8.8 million in each biennium ongoing added to the base for those grants as well. As has been noted today, School-Linked Behavioral Health Grants are one of our most successful DHS grant programs. We have extraordinarily talented staff and policy experts at DHS that build partnerships and that really make this program so successful. It's received national accolades. I think we're in about 82% of school districts across the state right now, and we're serving just around 14,000 students per year. So it's a really impactful program. And we've heard today, and we know that there's workforce shortages, but we also know that children and families are really struggling right now, especially following the pandemic, where we're seeing increasing of increasing needs, increasing severity and needs. And so we really want to make sure that right now, especially at this moment in time, we're able to intervene and get people access to those services as quickly as possible. So we're really hopeful that members will support this legislation so we can continue to expand this important program, reduce those waiting lists, and really make sure that students and families have access to these life-enriching, oftentimes life-saving services. Thank you, Mr. Chair.
Thank you so much for your testimony. We now have member discussions. Representative Kwong.
Thank you, Mr. Chair, and I'm trying to understand a little bit how this would interact with some of the special education districts. I was on the governing board of ZED, which was a cooperative effort between multiple small districts in rural Minnesota, which, for special ed, gifted and talented, there were cooperative things of where they couldn't hire a .3 or a .25 position. So they got together, said the critical mass to be able to organize it and deliver. And I wonder if that is taken into account when grants are put out, because you've got the criteria of highest percentages, special ed with emotional behavior disorders or high poverty. And, having been involved, the need, especially in rural Minnesota where you've got the small schools, if you do it, you might have some schools that don't have the percentage and other schools that do, but you're cooperating to get a critical mass. And how are you going to treat that for grant prioritization?
Representative Beam.
Thank you, Mr. Chair. Thank you, Representative Quam. I think that the logistics of sorting that out as to where the funding goes based on need is paramount in how these grants are awarded. I don't have the granular details on how that is assessed, but I know that they are focusing on schools that have not been involved in the program previously, and also working to continue with those schools that have had it, and in multiple schools, multiple districts, trying to reach those students who may have been left out of the program for one reason or another, some of which you described. So I can get the department down here if we want to have a deeper dive on that, but that's what I know is they're trying to make sure that the care gets out to where it needs to be, and that's the goal of the effort. We can bring someone down if you want more detail.
This bill will be coming back to us.
Mr. Chair,
Representative
the point is that we really need some clarity, because the landscape is different in parts of greater Minnesota. And we've got some non-standard ways of organizing for this type of support, and that's actual schools organizing together. And so that's what one of the things that maybe they can give us some clarity later, not taking up the time now. But the other question I've got is, on here, I'm familiar with districts where in Rochester, the parochial school was mainly in person. And I've had conversations with people with a Rochester school district that were quite a bit remote. And the exacerbation of some of the mental health concerns and issues because of those situations, looking at the language, I didn't see that is coming into some of the picking. If you're tied, that would be one of the things, at least secondary consideration to concern, because of, if you had a year and a half of remote, you would be, and you had the same percentage of students in special ed or low income, you would have, I would think, a higher need than a district that was almost totally in person. So, I mean, we simplify in the bill, but I think there's a more complex terrain that we might have to give guidance in the final language. Thank you, Mr. Chair.
Thank you, Representative Quam. Did you want to comment on that, Representative Beam?
No, I think I understand the points that Representative Quam is making, Mr. Chair, and I appreciate that, and that's the kind of detail that I would expect the Minnesota Department of Education and Health are looking at when they award these grants.
Representative Keel.
Thank you, Mr. Chair. Representative Bierman, I really appreciate this bill. I actually got an email from some individuals in my community, and the number one need that they see is that the increase in this actually does allow them to go a little bit more out into greater Minnesota, into the rural areas. So I do like that they pointed out specifically in my community that's one of the areas that this would help fund. I do want to just pause for a minute and remind individuals who are listening, we have brought up that when we don't support or invest in mental health, that it can end in suicide. And anytime that we talk about that, I just want to remind people that 988 is a number that can be helpful if anybody is feeling suicidal or have those attempts. I want to highlight from a Minnesota lens why this is so important is that we actually we're higher than the national average for suicide in Minnesota. And so I think that absolutely we need to invest in these initiatives. And also it's the second leading cause of death for our kids. And so we do know that this is impacting us from border to border. And when we have horrific numbers like that, I think that this is absolutely the solution to things like that. And so I appreciate you bringing this forward and appreciate us making the space to talk about this. Thank you.
Thank you so much, Representative Keel. Next is Lead New Brindley.
Thank you, Mr. Chair, and thank you, Representative Bierman. I have two sort of questions for you. One, I'm wondering, the commissioners shall ensure grants are distributed to rural and urban counties. Typically, when we see language like this, there are numbers engaged. Like 40% of the grants would need to go to rural Minnesota. Is there a reason that you left that out of this language? Well, I mean, the background is typically that language is usually included because otherwise rural counties get left behind. We just don't get the same funding that the urban counties get. So is there a reason that you specifically left that language out of this bill?
Mr. Chair, Representative New Brindley, no reason specifically, but that's good data we should probably get and be aware of it so that we do know. And we may have it right now if you would like to hear it. Otherwise, we can get it to the committee.
If we have the answer, we'll get back to the committee because this bill is coming back. So, Lead New Brindley.
Thank you, Mr. Chair. And perhaps that's something we could consider adding into the language as this moves to ensure that those rural counties really are represented with this funding. The other question I have, and I know it's ticky-tacky, but I really get hung up on words. And on line 110, it says, at least 25% of the new funding must be targeted to providers that can serve schools that have the highest percentage, ... That word can concerns me because that just means that they're able to. It does not mean that they are compelled to. It doesn't mean that they must. It doesn't mean that they will. And so I would like to consider also if we can change that one word to ensure that these providers are serving schools that have these high rates of special education students. And, the reality is we talk about it a lot, but we talk about it because it matters. There's a lot of fraud in the system, and tightening up little things like that can help eliminate the potential and the possibility that the funds would be misused.
Mr. Chair, Representative New Brindley, that's a good catch. That's something that we should look at as far as the language goes. And I know you get hung up on words sometimes, and I appreciate that. I've seen it numerous times in committee, so you're doing well on this. And the reason we come in before committees is to make bills better. So I appreciate your input on it.
Lead New Brindley.
Thank you, Mr. Chair. Thank you, Representative Bierman.
Jeff Fisher.
Thank you, Chair Endor, and thank you, Representative Bierman, for bringing this forward. I know how important this is to make sure that we're better meeting the needs of our students throughout the state. My question's a little bit for the department here because it's going to be kind of a technical one. The question I have is I know that we're looking at a large increase here, and we're looking at probably working with organizations that they have not been working with before. And what I'm getting at is that there gets to be a cash flow situation where people are putting out the cash first and then for reimbursement. So I kind of want to know how the process is going to work for the granting, for the reimbursements, so that things are happening on a timely basis. Because if we're talking organizations outstate, they're probably smaller. They're going to be struggling to make sure that they're getting timely payments. Can you address that a little bit for us to make sure that we don't have people waiting for months to get payments?
Ms. Graham.
Mr. Chair, Chair Fisher, it's my understanding with this particular grant program that we have been able to do a pretty good job of making sure that people have the funding that they need to get those services delivered in a timely manner. I'm not sure of all of the specifics of exactly how people are reimbursed through the grant that way, but I can certainly follow up. It's also my understanding that we are looking to do with this bill potentially a request for information from providers and school districts to really understand who aren't we talking to right now and who might be interested in accessing some of this new money. So if there's potentially new smaller organizations coming on board, we want to really work across the state with all of our communities to understand who they are and what their needs are.
Jeff.
No, thank you. And that's part of the reason I'm asking is because some of these small organizations may have a situation where they're going to have cash flow issues trying to do this. And these are the people that we really need doing the work. At the same time, I know with a number of the granting options in the past on different grants that DHS does is that they are not able to put any of the money out until after expenses are incurred and documented. And that's why I'm raising the issue is because we want to make sure we've got good accountability, but we want to make sure that these small organizations out there that want to do this work have that flexibility with the accountability built in. And that's why I'm raising the issue to make sure that we're keeping that in mind as we're moving forward with this bill.
To Ms. Graham, do you have any closing remarks on this?
Mr. Chair, Chair Fisher, I think that that's an important point, and we'll certainly take that back to the team. I know we're actively looking as a department at procurement processes and requirements in general, and which of those requirements are items that maybe DHS imposed following, you mentioned integrity, but following audits, oftentimes those requirements come on, and which ones are maybe requirements through, the Department of Administration, and what can we do to create more flexibility and nimbleness so that we can make sure that we're getting the money into the hands of people who need it.
Thank you so much. I think that's it from members, but I just wanted to note that this is really an important issue. Our schools are asking us to support them. As someone, I had a child who had selective mutism. If if that child didn't get the help within the school setting, it will have led to a difficult moment for her to continue with her education. Thank God we had school-linked mental health support in her school that could provide the services that the student needed. So this is a really important aspect because our kids need to thrive in school, and the support that this bill will provide is critical for our schools within the state and supporting every kid in the state of Minnesota. With that, I would like to give you your final remarks before I renew the motion.
Thank you, Mr. Chair. I appreciate the good conversation with members today, and I ask for your support for the bill.
With that, I renew my motion that House File 564 be re-referred to the Education Finance Committee as amended. All those in favor, please say aye.
Aye.
Opposed? See none. The motion prevails, and you are on your way to the Education Finance Committee. Thank you so much, Representative.